We do ongoing educational workshops every 2 weeks, and the topics change depending on what you folks request and what the doctors want to do. This is the first time I've done this talk, so while I was putting it together, it really opened my eyes to a lot of issues that I didn't know affected the brain. And a lot of these things that we're going to talk about tonight are controllable. So the answer is the sooner that you implement some of these things, the better off you're going to be. How many people came here tonight because they're concerned about developing Alzheimer's and dementia and those types of things? So a lot of people, okay. Well, the talk's going to touch on that, but it's going to talk about a lot of other brain dysfunctions that we get aside from these things and maybe before them. So I think as we go through tonight, you'll understand how the brain communicates and how all these disorders can interact, okay? So, quick overview, and you all have a handout. Unfortunately, you're going to probably want to take some notes because I couldn't put all the slides information in there, so I'll try to take my time. If we have small questions as we go along, I'll try to answer them. If there's big questions, I'll wait till the end, because I want you all to leave here understanding what I said and definitely get something out of it. We're going to start by talking about basic neurology and brain functions. If you understand the way that we're designed, it makes it easier to understand when things go wrong and how to reverse engineer it to make it better. We're going to talk about the 3 things that ultimately affect our health. So for anybody who's been here before to see a lecture, we hammer this home hard, right? The chemical changes because of diet and lifestyle, structural changes maybe because of injury, and stress patterns because we live in Northern Virginia. These are the things that cause brain problems. These are the things that cause rotator cuff issues, gut problems, on and on and on. The big triad, we talk about it a lot. I will specifically reference some metabolic testing, which is separate from that brochure, the brain span test that we're going to talk about. So between these 2 tests, you're going to be able to get a fairly good understanding of what your brain's doing and relatively how healthy it is. There are advanced techniques for imaging, SPECT scans, PET scans. These are above and beyond. These are things that are extremely expensive. They have value, but I think when you start with these, especially before you have a problem, you can pretty much make sure things that don't progress too quickly or certainly can slow them down. And then obviously we're going to talk about the things that you can do to help yourself, okay? A lot of those things involve changing these parameters, okay? I embedded a video that I'm going to have Sybil put up because I just found this and I think it's fascinating, and when you see this, you're going to understand how quickly and dynamically your nerves grow and how quickly things can go wrong. Who gardens in this room? We have gardeners? Okay, do you know what a bonsai plant is? So nerves are like bonsai plants. As they grow, you prune them back, and that's what the nervous system does. So this is a time lapse of nerves over time. So as you can see, they start to sprout out, and then they start to prune back. So these are nerves growing. I think this is over 170 some hours. Okay? So let's watch it again. Here's from the beginning. So watch the nerves start to grow. They get bigger, right? They kind of conglomerate, and now they start to kind of pull back and condense. That's the way your nerves grow. And if you notice, this nerve communicates with that nerve, he communicates with this nerve, and so on and so forth. It's like planting boxwoods. When you first put them in, they don't touch each other. Fast forward 20 years, you can't tell where one starts and one ends. That's what your nervous system does. So, really cool video, and when we go through tonight, you're going to understand why this is the important part of everything we're going to discuss, because this describes what we call plasticity, the ability for the brain to develop and to communicate. Hey, Sybil, can you put it back? So I thought that was pretty interesting, especially for the people who garden. Okay, so let's talk about some real basic brain facts, and I'm not going to weigh you down with too much stuff. The brain weighs about 8 pounds, but it uses about 20% of all the energy the body needs. So that's a lot for an 8-pound object using 20% of all of our energy. And it uses it in the form of glucose. Sometimes it uses it in a form of ketones, right? Have we heard of ketones? So the keto diet, so the brain can function off of ketones. It prefers glucose, but it can use ketones. And really, the blood sugar powers something called a mitochondria, which is the power plant in every one of our cells. And I'm going to show you a slide later that talks about how important that is. When we're in a starving state, the body will preserve itself, and it literally will start to eat its own self. So when we go on a fast, we break down tissue to release these ketones, okay? So that's why intermittent fasting has become popular, because we now know that even though we're breaking tissue down, we can still thrive in a starvation state. Now, we don't want this to go on for weeks on end, but for the short term, it's relatively okay. The brain communicates extremely fast, about 268 miles per hour, and it does it through this sheath that surrounds all of our nerves called myelin, and I'm going to show you a picture of it. The sheath is composed of fats and cholesterol. So are fats good or bad? Right, they're good. So we get hammered all the time to think that fats are bad. They're important, and we need them for nerves. 60% of the brain is a fat of one kind or the other. 20% is an omega-3. We heard of the omega-3 fats, right? The fish oils, called DHA, and that's made by the body in very few situations. So this is something that's almost exclusive from our diet. If we don't get it, we don't make it. 20% of the body is cholesterol. So in a low cholesterol diet, we start starving structures, and the brain happens to be one of them. So in the Journal of Neurology, they showed that people over the age of 70 who had higher cholesterol, normal to higher, actually had less risk of dementia. So what do we do with people from the age of 15 on who have high cholesterol? We put them on statins and we suppress the cholesterol. Well, that comes at the expense of the nervous system. And it's interesting that the Journal of Neurology says, hey, we found out that when you have normal to high cholesterol, your brain is actually healthier. So we might want to think about those things moving forward. My personal opinion is the statin drugs will be the new hormone replacement. Meaning, when my mom was hitting menopause, they beat her down to tell her she had to take hormone replacement because that's what we do. Fast forward 30 years, research catch up, and they said, you know what? It actually didn't really lower heart disease. It didn't really lower cancer or this or that. So forget all that stuff that we said. My personal thought is we're going to get enough research 25 years from now that says all this cholesterol that we've been pushing down was a bad idea, and it's going to be causing problems most likely up here. My opinion, but I think you're going to see trends towards that. Okay? So when we have low levels of omega-3s, that's the good fats, the brain actually shrinks, and if we don't have enough at all, it's like taking 2 years off of your brain's life. Okay? So again, what about the statins? So think about that as you move forward. Okay? Let's talk about the basics of memory. Okay? 3 things need to take place for us to remember something. And we process all the time. Sometimes our brain decides not to actually store it. The first thing that we do is something called encoding. That's where stimulation, and it can be visual, it can be auditory, it can be nasal, is coming in. Our body is going to encode that and give it some sort of level of significance. At that point, it's going to do something called storage, okay? It's going to put it into either short term, that means that we can recall it and get rid of it in maybe seconds or minutes or hours, and then long term. So this encoding is called building an engram. So the brain puts aside a special part of itself for this one memory. And then when needed, we retrieve it. Okay? And we usually retrieve it by some sort of cue that tells us to do that. I'm going to share a personal experience. When I was in college, I went to a party and there was some rum punch there. I drank the rum punch and fast forward, I got sick, okay? From that day forward, anytime I smell rum, within 2 seconds, I feel nauseous because I encoded the rum, I sent it to long-term memory, and then my olfactory makes this retrieval within seconds to where I say, ooh, we don't want that. So that's the way you work. Same thing holds true when a person's in an automobile accident. Who's been in a car accident here? Okay, after that accident, when you hear the sounds of brakes locking up, what do? You go into that reflex because you've encoded that accident because of a sound, you stored it and you retrieved it. So it's the same thing. That's the way we process things. So if it's not an important memory, then we wipe the slate clear and we move on. So the brain's pretty important. So repetition becomes a big part of this. So that's why we study and that's why we look things over and over again. Okay? Well, let's start from what we call the cell level. So we talked about just basic memory. How do we communicate and how do we power all this? Well, it all starts at what we call the cell level with something called the mitochondria. Okay? That's this guy. The mitochondria is the little tiny power plant in every single cell of your body. The more active the cell is, the more energy it needs, guess what? The more mitochondria it has, okay? So the brain has lots of them. Its responsibility is to help control your DNA. Your DNA is your blueprint, so that's where your body makes new cells and does things. We have this blueprint at all times, and it helps to repair stuff, okay? It controls inflammation in your body, and it tells something called a stem cell to go to work. Have we heard of stem cells? That's a big thing now. So stem cells are undifferentiated cells. They can turn into anything. So your mitochondria has a role in telling these stem cells to go do what they need to do. I want you to turn into a nerve. I want you to turn into an intestinal tract, this, that. So, because the mitochondria is in every cell. As we age, unfortunately, we have less mitochondria. So it's safe to say that someone who is prematurely aging, who is aging too quickly, is probably dealing with a mitochondrial defect. And a lot of the anti-aging stuff that you read about, you'll see articles about body hacks or life hacks. It's about how to preserve the mitochondria and how to preserve the DNA.
Is that actually proven that there can be things to help?
Absolutely, absolutely. Yep, and most of the, so the question was, is there things that can actually affect that? And to answer that, it's yes, and most of the time it's to prevent damage to the mitochondria and to the DNA. It's all about playing defense in the body. And for that matter, it's all about defense as far as the nervous system concerned. The nervous system's responsibility, 80% of it is to tell something to not happen. Don't do that, don't do that. So it inhibits things. That's what the nervous system says. You stay there, stay there, stay there. So when the nervous system breaks down, we get these breakthroughs. So we start expressing things. And that sometimes is not good. So if we can take care of the mitochondria, then we can slow aging down. And probably 100 years from now, we'll figure out a way to, through stem cells and other ways to manipulate the mitochondria so we can live hundreds of years. Scary, but true. Okay, so this right here is a nerve. So I showed you that video, right? So all those things that were going out like tentacles are these nerves that are growing. Right here are what's called dendrites. These are the little fingers that touch everything. These are the things that get information, okay? These are encoding at all time. They're bringing in information. And they send the information to a little tiny brain inside of it called the cell body. And it's really cool. This cell body actually determines if things are important enough. So it helps us out by filtering out nonsense. If it's important, then it sends the information along this. This is called an axon down to here. And then this will communicate with numerous other nerves. So it's like that that tree that's growing. It's going to branch out and it's going to communicate with everything. The most important thing probably for the sake of this conversation tonight is this right here, this axon and this covering called myelin. It's fat, it insulates it, and it greatly speeds up the process for communication. So when the myelin starts to break down, it's like a frayed extension cord. It works sometimes it doesn't. It sparks, sometimes it doesn't spark. And it typically breaks down because the saturated fats and the omega-3s that surround it break down. And it breaks down, causing the slower speed. And the most common example is multiple sclerosis, okay? We're breaking down that myelin, but it happens in other things. So when these guys break down, then the plasticity, that branching out, becomes different. And sometimes it branches out in the wrong direction. Just like when you plant that tree and it starts to grow into the house, right? It grows towards the house. Well, what do? You don't want it to grow towards the house, you prune it back. So the way the body works is it continually is pruning the nervous system and hopefully sending it in the direction that it wants to go. So on a larger scale, when we look at the brain, which is a whole bunch of nerves, so it's that nerve that I showed you plus thousands and thousands of others, they make up sections of the brain. And this part of your brain, which is right here, is called the prefrontal cortex. I'm really only going to talk about two parts of the brain because they're really the most important. So this guy in the front is the granddaddy. This is the one that has all of the executive functions. This is the one that gives us, it helps us be more reasonable. It helps us make good decisions. It gives us our personality. It makes us different than a dog or a cat that doesn't really have a personality. This is the biggie. It helps us make decision making and learn from that, okay? This is the area that when it starts to fail or it gets overwhelmed from another area that I'm going to show you, causes people to start to have changes in their personality or maybe outbursts. So children who have ADHD either have underactivity here or another part of the brain is suppressing it, okay? So when folks start to change their personality, then you start to think that there's something going on in that part of their brain, the prefrontal cortex, okay? Yeah, absolutely. And medication most likely would affect the way the nerves communicate. It would speed it up or slow it down. Guess what? The highest concentration of that mitochondria, those energy cells, are in this part, which would make sense because you know if you need good executive decisions, you want to make it like this. So you can't lag behind waiting for more energy. So what happens when we're not eating regularly and we're skipping meals? Are we sharp or are we kind of not so sharp, right? So some people, it affects them and they're like, you know, I can't read right now, I can't do this math equation. So energy, you gotta pump it in there. The next section that we're going to talk about, and this is a section that communicates always with the prefrontal cortex, is what I would kind of call its kind of, I don't want to say evil, but this is kind of the mean stepbrother of the prefrontal cortex. Okay? It's called the hippocampus and the limbic system. So first and foremost, because it's the bad, mean guy, he's kind of in the dungeon. So he's in the center part of our brain, deep in the brain. Prefrontal cortex is right out in front, right? It's like the CEO, he's always there. This is the people behind the scenes. Now, what happens in the hippocampus is his job is to really store those memories, good and bad, okay? And his other real responsibility is to give us emotion to different responses. And emotions obviously are normal. So that can be fear, sadness, we can be happy, you know, all those things. If we overexpress in the hippocampus, then we're going to have outbursts of emotional things, okay? We might yell, or we might be really upset, or we might cry. So the crosstalk between the prefrontal cortex and the limbic system tries to get us in balance. So we are at a place that we can keep our cool, literally. It has a lot to do with spatial memory, so we can navigate the world, okay? and it contains the highest levels of stress receptors in our body. So cortisol is a stress hormone. Cortisol affects this, okay? And that's why when we're under a lot of stress, we're more apt to crack, right? We're more apt to get mad or bite back at somebody. It's because these stress receptors are activated. And there is now a new term called amygdala hijack. So this is the hippocampus. At the very end is something called the amygdala. And this is really where our brain concentrates all those emotions. So when the prefrontal cortex becomes quieter, the amygdala says, because it's the mean stepbrother, oh, I'm going to take advantage of this and I'm going to start running the show. And that's what happens. So this is a very real concept with kids that have ADHD. Their amygdala is suppressing their prefrontal cortex. And because our prefrontal cortex doesn't fully develop until we're 25 years of age, that's why the kid is at a disadvantage. They don't know right from wrong. So if this guy can take over, then the prefrontal cortex might not ever completely develop. So that they're making irrational decisions at 35. Okay? So if you Google this, you'll see an endless amount of research. So I talk about these two guys, the amygdala being like the devil on one's shoulder. Prefrontal cortex is the angel. You remember those cartoons where the angel would say, don't do that, and the devil would say, well, why wouldn't you? And it's this crosstalk that allows us to not do things that are not appropriate. Probably the best example of the way that these two talk is, if you were to stand at the edge of the building, right, and look down, part of your brain is going to say to you, I wonder what it would be like if I jumped, right? It's the way the brain works. But then your prefrontal cortex says, completely bad idea. And that's why you don't. So when we have conflicting communication between the two, that's more likely for the impulse person to try to jump. So.
Because they're there, do they age more rapidly?
Yeah, very much so because of this, the stress receptors. That's why we're under a lot of stress, because it has a lot to do with memory. We're like, wait, what did that guy just say? Yeah, so stress is a biggie, and we'll talk about that. Cortisol. Cortisol is huge. It not only does it eat away at our brain, it makes us more apt to be overweight and have hypertension and diabetes. It's just not good. So let's talk about the big two and get them out of the way, okay? Which is going to be dementia, which is an umbrella term that includes these type of issues. We've all heard of Alzheimer's, right? So Alzheimer's we're going to go into specifically. So Alzheimer's is usually not diagnosed initially. It has to be a constellation of symptoms that I'm going to show you. But it makes up about 50 to 75% of the people that are initially diagnosed with dementia. The next one would be folks that have vascular complications, so that makes up 20 to 30%. There's something called Lewy body. We'll talk about that. And then this frontotemporal, which is about 10%. So if I said before that the prefrontal cortex has a lot to do with personality, so I'm going to give you guys a quiz. Because this guy involves the frontal zone where the prefrontal cortex is, what do you think this person does a lot of? This person who has dementia. Correct. They do things that they shouldn't do. This is the older person that's giddy for no reason. This is the older person that, just does childish things. Okay? So you can see how these guys attack different parts of the brain. So let's break the two biggies down. So dementia, typically outside of Alzheimer's, involves a vascular event, meaning that we have a restriction in blood flow, okay? That usually happens because of uncontrolled hypertension or blockage of blood vessels or small ischemic attacks called TIAs, okay? And as these blood vessels get beat up over time, they basically they sag and they kind of burst and they become less effective. And what you will often see is when a person gets an MRI because they think that they have dementia, the doctor will often say, well, there's diffuse vascular disease, which means that these blood vessels are being damaged. The interesting thing is kids that have head trauma, people in their 40s and 50s that have it, sometimes they still show up with these vascular disorder, okay? A lot of this has to do with inflammatory situations, and it has to do with environmental factors that are just damaging our blood vessels. The brain is extremely forgiving. We can abuse it a lot, and we might not even know it. So very often, these vascular findings are incidental to an injury. A person slipped and fell, and they hit their noggin. They do an MRI, and they're like, I don't see anything, but you have this vascular stuff, but it's not a big deal, they'll say, okay? Because it's common. And that's the problem. If it's common, it's not a big deal. I don't agree with that, but that's why you go to the doctor. He runs blood work. He says you're fine. You take your doctor to somebody else, and they're like, hey, did you know you have this wrong? And they're like, well, he never said that. Because he sees it, or she sees it all the time. Now they start to overlap the word common with normal. And I see that all the time. People, I had a new patient today. He came in because he had tingling in his feet. He wasn't sure if it was a disc or something. I look at his blood work. He's got high blood sugar for the last 4 years. It's progressively high. And I'm like, you're getting diabetic neuropathy. And they're like, wait, I don't have diabetes. I'm like, your blood sugar's high. But because it's common, they don't bring it up. So it's not right, but I'm just telling you what I see. This Lewy body is a problem with proteins getting deposited in our brain. And when we look at Alzheimer's, it's a protein problem as well. Proteins are there to help protect us in certain situations. They repair things, okay? However, if we just start to arbitrarily plop down protein everywhere, it makes things sticky. It's like drywall. If I put a hole in this drywall, right, and I spackle it over, the best thing for me to do would probably sand it, right, so it's smooth and paint over it. Well, proteins are like spackle, but the body sometimes doesn't sand it and it leaves it gunked up. And then it decides it wants to put more spackle or protein on it. And then eventually everything is gunked up. So that's really what happens here, okay? And this one we talked about, this is the older person who personality starts to change. A lot of times that's because of chronic stress patterns or even trauma. They damage that prefrontal cortex, okay? So here's Alzheimer's. And again, Alzheimer's is another issue about proteins. In this case, it's what we call an amyloid plaque, okay? This is real small, so I apologize. Here are nerves, okay? And they're happy and they're talking with each other, okay? Here are nerves. They try to talk to each other, but these plaques get in the way. So it's like taking that extension cord and fraying it or cutting it. So sometimes the impulse works, sometimes it doesn't. So we form more or less scar tissue. We're really not sure why this happens. And in fact, we now think that maybe this amyloid plaque is a protective mechanism and not necessarily the cause of the problem. In other words, the body is trying to fix itself, and it lays down these plaques. So it might be a byproduct of something we're not aware of. So Alzheimer's is really a gray area as far as, why do we get it and what causes it, we know what accelerates it, but sometimes we don't know why it starts, okay? The interesting thing is when people develop dementia and Alzheimer's, they get symptoms of just getting older. Oh, she's becoming forgetful, or she's moving slower, or she's having these problems. So very often years go by, and because we're just getting older, it might not be diagnosed until the person is extremely far progressed, okay? The interesting thing is one of the initial things that takes place is we lose our sense of smell, okay? Now when I say that, this is not for the people who've had head trauma or face trauma. A lot of people lose smell because they've had face trauma, and they literally tear the nerves of smell away from their nose. But this is a person who's, for their whole life, has had no issues with their smell, and all of a sudden now they're like, I don't really smell things. Could be Alzheimer's lurking around in the background. okay? Eventually, we start to lose executive function, speech memory, and then organ system failure, okay? So there's a progress. Not everyone gets Alzheimer's, and it's certainly, it's controllable. So let's talk about the big three. In this office, we reference this triangle all the time. And for us, myself and the other doctors and practitioners, this explains why somebody walks in the office with a bad shoulder, why you walk in because you have digestive problems, why this young lady has allergy problems, and why you come in with all four of those things, or all six of them. Because we have issues on different sides of the triangle. So I'm going to kind of break down the different sides and how they can start to impact us. I probably could turn this lecture into a 4-day one and cover tons and tons, so I'm sure there's things that I'm not going to touch on, but these are the big things that I want you to know about. So with stress, is stress good or bad? Can be both. You get a star. So what's bad stress is called distress, good stress is called eustress. So what's an example of good stress?
Moving.
Yeah, moving, gravity, that's good stress. It makes my bones strong, right? You know, learning, that's a good stress. Lifting weights, bad stress would be maybe lifting too much weights. Or maybe I'm spending too much time reading. You know, my eyes hurt, you know, so we have a threshold. So when we start to have chronic stress, because of whatever reasons, because of traffic or marriage or finances or what have you, then the chemistry in the body starts to alter itself. And I said before that proteins have a lot to do with the way the body communicates and talks. So there's a protein called BDNF in the brain that literally helps the brain heal. It's like a fertilizer. And what happens is when we're under stress, the stress hormones, cortisol and the other hormones, start to suppress this. So this is like me who, for every year for the past 10 years, I fertilized my yard and took great care of it. And then one year I stopped. And moving forward, I did less and less. So as time goes by, the lawn becomes less and less perfect. Well, as we have more and more stress and this fertilizer is decreased, then the brain starts to change. The first thing that we see is that hippocampus, it shrinks. Okay, remember the hippocampus, that's the one that's deep, that's the kind of the not so nice brother, but he's really responsible for memory. Okay, so we see when we're under stress now, because it's shrinking, my memory's not as good. You know, boy, I got to start writing things down. Well, as it shrinks, the cells start to get starved. The mitochondria, right? Remember the energy guys? They get beat up. So then our nerve cells start to die. Okay? Now, that doesn't mean they're all dying, but that means they're prematurely dying. So they're accelerating. As they're dying, because this is our stress regulator, we start to handle stress worse. Okay? So now we amplify the problem. Okay? The memory goes downhill. This takes several weeks, but when I look at this, that's not much time, right? That's a pretty short amount of time. So the take-home message is when we're under stress, chronic stress, within a week or two, our brain is starting to be affected. It is physically shrinking. So you move that forward by 5 years, 10 years, then we start to see changes that may show up as early signs of dementia or Alzheimer's. Okay? Those nerves, because they're under stress, now they don't talk to each other. Okay? Everybody's on their own. So when they stop talking to each other, then they start to die back as well. Okay? This can be reduced if the stress is reduced. Okay? So, a huge component for people, especially folks that have memory problems, is they have uncontrolled stress or they have inappropriate stress response. So there's ways that you could control that as far as meditation or those types of things. I will talk about some different nutrients that will help to buffer the byproducts of stress response. That does not mean that you should still be exposed to the stress and just take a whole bunch of vitamins, but it takes the pressure off the system. Okay? So how does the stress affect our executive area, the prefrontal cortex, okay? Well, just like that hippocampus, they damage the front part of our brain, so the executive centers. So not only is my memory getting poor because the deep part's getting beat up, now I'm doing things that are becoming maybe a little bit irrational. I'm snapping to judgment more, I'm doing things that are not appropriate, and that happens when these cells, these other proteins, start to form. And do you see these proteins starting to grab hold and strangle the other nerves like a tentacle? That's what they do. So we form these proteins as a byproduct of the stress response. It's the way the body is trying to stabilize itself. Unfortunately, it doesn't really work well over the long haul. The stem cells in our body and in our brain start to change to these octopuses. So instead of them turning into healthy nerves or healthy support cells, they're just turning into these octopuses and starting to grab hold of things. Okay? So it makes the myelin sheath become thicker. Remember we talked about the nerve has the fat wrapping? Well, we want a certain amount of insulation, not too much, not too little, but now it's wrapping around the myelin, so it's slowing down the way it conducts, and it starts to increase our fight or flight connections. So now our stress response in the deep part of our brain starts to talk to the front part of our brain, and it goes back and forth, back and forth, back and forth, okay? And our sympathetic nervous system gets caught up in this. The sympathetic is the fight or flight. So now maybe our blood pressure starts to get a little bit higher. We have faster respiration. Our sleep cycle becomes poor. That's the way the body communicates. Unfortunately, it's like the drowning man. When one part goes down, it's going to try to grab other people as it's going down. Well, the lymphatic system is there to help try to save the show. The lymphatic system is the garbage disposal of your body, and it's in your brain as well. During the course of the day, the lymphatic system goes in, it sweeps up the house, it dusts and does all these things. Just like this building, it does it a lot more at nighttime, because when you're sleeping, nerve functions less, so the lymphatic system doesn't have a lot of people in the way, and it can clean things up, okay? It washes our nerves with something called cerebrospinal fluid. There's a fluid that surrounds our brain and our nerves, and it bathes everything, and it carries trash out, okay? If we get good quality sleep, we typically clean the brain nicely, and we usually wake up and feel relatively rested. If we don't rest, then we don't take the trash out of the house as efficiently, okay? One of the things that you're going to leave here with tonight, actually two of the things, is one, the importance of sleep when it relates to your brain, and the importance of movement. So sleeping is important because it helps us clean house. And a lot of what we're talking about tonight as far as Alzheimer's, dementia, is the accumulation of excess stuff. Proteins are just accumulating. Well, if the lymphatic system can do its job, it can buffer that and slow it down, okay? Because I have amyloid plaques in my brain, but it's relatively healthy, I'd like to think, right? Knock on wood. But that's what happens. We build them, we break them down, okay? So when our sleep is interrupted by apnea, who has apnea in here, okay? Because we maybe have a constricted airway, or maybe sometimes our brain tells us not to breathe, or more importantly, we do not enter REM sleep, that's deep sleep, then we don't have good quality restoration at night.
Does REM sleep with dreams?
Correct. So she asked, does REM sleep have dreams? Yes. So who does not remember their dreams? Because everybody, okay. So when you don't, you're typically not drifting deep into that REM sleep. Okay, the body and brain oscillates through the course of the night, but usually if you don't remember it, your trajectory is just kind of shallow.
So if you wake up, you go to the bathroom, go back to sleep, if you pick up the same dream where you dream again.
Yeah, but the sort of question is if you wake up a lot, the problem with that is you're not in autopilot for long enough. You're kind of getting on the highway and putting it on cruise control, and then all of a sudden you got to tap the brakes and get up, and so restored sleep is long time. Yes, ma'am.
But
times though that I wake up the most tired is when I have what I call you are there dreams, where the dream is so vivid, it's almost as if I was actually there. So when I have those kind of vivid dreams, that's when I wake up dead tired, like I didn't actually sleep.
So you probably you go into stage 1 and 2, and then that's when you start really dreaming, and you should kind of keep going. You probably plateau there, and then your dream wakes you up, and then you probably do it over and over the course of the night. So this slide probably has a lot to do with you. So there's a hormone that we produce in our brain called GABA, and it's inhibitory. Remember I said the brain's responsibility is telling everybody just to stand down? Well, sometimes we don't produce enough of this guy called GABA, so we can't keep everybody quiet. So then the brain starts to be overactive, okay? The quickest way to get rid of GABA or reduce it is to be inflamed. So I'm going to talk about chronic inflammation and the problems with that. Probably the second biggest way to mess with GABA is to have blood sugar imbalances, okay? Your blood sugar is not stable. This is either the person who doesn't eat right, or the person who eats too much refined carbohydrates, or maybe they eat a big carbohydrate meal right before bed. And you know, we've all been there, you know, we just don't sleep well. Alcohol, you know, all these affect GABA, okay? The interesting thing is any source of inflammation in the body, doesn't need to be in the brain, can cause sleep problems. So chronic sinusitis, arthritis, gastritis, you know, all those, because we produce these hormones that tells our body that we're inflamed. And it not only does it want to tell my knee it's inflamed, but those hormones want to tell everybody else that my knee is not happy. Unfortunately, the brain has to be part of the picture. So chronic pain syndromes or chronic inflammatory syndromes are really important. And I'm going to show you a slide later about people who have chronic pain and how much their brain actually shrinks because of that.
And also be you have too much sleep versus not getting enough or broken sleep.
Sure.
Anyway.
Yeah, I mean, you could want to sleep more, and then you probably are getting more caught up in, you know, that this guy talking with this guy, and then something's got to give, okay? The interesting thing is we actually need to be exposed to light to properly sleep. So we need light to sleep, but we should sleep in a dark environment. So I talk to a lot of my patients about sleep hygiene, which means that the room should be very dark. You shouldn't have flashing lights from the TV or the clock radio or those types of things. So a very dark room becomes a good thing to help you have good sleep hygiene, because you are going to produce another happy hormone called serotonin that gets converted to melatonin. We've heard of people taking melatonin, right? Okay? So when you take melatonin, you're kind of cutting out the middleman, which is serotonin, and you're just putting in one piece of the puzzle. But as you do that, then the body's response is to say, well, maybe I don't need to produce as much. So you got to be careful with melatonin for long terms, especially if you're taking it in super high dosage, which I would say is 10 milligrams or higher. And this is for sleep. You'll often read research about cancer and how they use high levels of melatonin. So, I mean, melatonin doesn't only just affect sleep, it affects a lot of things, but you have to remember that because it cross-talks, we might want to be addressing one problem when we can sabotage the others. So always think about that when you try to fix things yourself. Are we sabotaging something else?
Can you check GABA levels?
Yeah, it's really hard to. Sometimes you can do it in your urine by what's spilled over. These are byproduct. It's not an exact science, yeah, because what's in your urine doesn't represent what's in your brain because of something called the blood-brain barrier. There's a barrier. There's a wall. There's a big wall around your brain, and we'll talk about how that breaks down. So, outside of them doing kind of, I would think maybe pulling cerebral spinal fluid, which you wouldn't want done, it's not an exact science. Yes, sir.
Relative to sleep, I was told that this is incidental to that, but waking up isn't a bad thing in sleep because if you get a negative experience or something not essentially positive within your sleep, the defense mechanism tells you to wake up and feel that pain.
Yeah, so I would say it's it's appropriate, but if you do it over and over and over again, you're never getting deep sleep. And that sounds like you're in a fight or flight mechanism. So the issue becomes now your body doesn't perceive what's not happening from your reality is getting crossed over because you're always fighting that tiger, right? You're always fighting something. So your body's going to produce hormones to combat that, okay? So when you wake up from a dream and it's, let's say, somebody's trying to kill you, right? Your adrenaline is pumping, your cortisol is pumping, all these hormones are pumping out. So I would say if you're having lots of vivid dreams that are like that, that's something that you'd want to investigate because you're not getting good sleep. And you don't want to produce tons of cortisol and what we call catabolic hormones at night. So we heal at night. So cortisol, I'm getting off on a tangent, but it's probably important.
In other words, bad dreams are a sign that,
Right. I mean, yes. I mean, there's something underlying there. So you would probably want to look deeper because cortisol is necessary, but if you produce too much, it's not good. Cortisol should be high in the morning, and it's got what's called a diurnal rhythm. It goes down, it goes up, and it goes down. It should be high, and then it should go down over the course of the day. So at nighttime, it should be at its lowest, and then it should start coming up, at 3, 4 in the morning to start to wake us up. But if it's always flatlined or elevated, then that comes at the expense of we don't produce growth hormone. It sabotages our insulin. So that's why people who are under a lot of stress a lot of times will slowly put weight on because they've got this sweet tooth and all these things that are being beaten up because of cortisol. So good quality sleep is important. So if you're waking up a lot, then you want to look closer at that. Okay. So structure has a big impact on the brain itself. So for folks who watch a lot of sports and stuff, you hear about this, TBI, right? These are the football players that have these injuries over and over again, and by the time they are 40, they're in pretty bad shape. And there is a research foundation that a lot of these guys are donating their brains to, and they're doing dissections when they pass away. And they're seeing that all of this head trauma has caused the brain to start to fail and break down. Just like a chemical stress or emotional stress, the body is going to try to repair it by laying down these proteins, okay? So falls, motor vehicle accidents, all those things, sports, they all are bits of micro trauma, okay? They cause a lot of inflammation, and this inflammation will be propagated. It'll just continue for long periods of time, okay? The delayed onset of the damage, in other words, small amounts over long periods of time, and the chronic inflammation slowly will lead to cognitive impairment, memory changes, those types of things. Does anybody here remember a football player who's still around who does a commercial named Brian Bosworth? Okay, so Brian Bosworth does a commercial for, maybe it's Pepsi. He plays the sheriff in the Pepsi commercial. So he's a famous college football player, played at Oklahoma, legendary. He has had so many TBIs and he got this encephalitis. And if you ever get a chance to see his interview with his wife, it's fascinating, it's sad because his personality has changed, and his wife sits there and talks with them about it. It's because of these repetitive head injuries. He's still around, but he's not doing well, and he doesn't really remember much. But he does the commercials, and they're funny.
Can several falls which have caused C2 fractures have any influence on that?
Absolutely, because the spinal cord communicates up and down. So when you traumatize the spinal cord or the nerves, it sends out inflammatory markers in the cerebral spinal fluid, and then those circulate. And those can cross the blood-brain barrier. So they'll start to nibble on the brain.
So what do you do about that?
Well, I mean, first of all, you got to make sure that the fracture is stable. Okay, you've got to make sure that there is no other residual effects, structural effects, because the first thing I think of with a cervical fracture is not really the brain. I think of the health of the spinal cord. Did they do a fusion with you?
No.
Okay, so it wasn't completely fractured. You had like hairline fractures in it?
They could have done a fusion, but we didn't.
Okay. So I would, I look at those things. If you start to show changes in your sensation or your, strength, then that sounds to me like you're probably getting a little stenosis, meaning that the spinal cord is being choked. And it can be choked because you start to form arthritis around where you injured it. So I mean, I can talk to you about after that. But the body thrives off of stimulation. So when we cut off the stimulation, then the body starts to fail. And that holds true for muscles as it does anything else. If we were to put a patch on my eye, we could only put that patch on there for so long before my brain says, ooh, this is interesting. I don't have vision out of this eye. And after a while, it will start to selectively shut down the vision centers in the back of my head to tell me to see. So in other words, even though my eye is perfectly healthy, my brain will say, I don't really care. I haven't had to do anything, so I'm just going to stand down. And it might not come back. That's why when kids have their eyes patched, you have to be very careful how long and for all those things, because it's the lack of sensation. So getting back to what you referenced, if you withhold a lot of sensory input, then this part of your brain, the cerebellum, is not happy. Now our balance is off.
Yeah.
Okay? So these are the effects of TBI, but I put this on here to kind of show you how you're different than an animal, to be honest. So this is the front, or sorry, this is the back and this is the front. So when we start from here and go forward, this part of our brain, the brainstem, the cerebellum, and this occipital lobe are relatively similar to an animal. This part deals with basic functions, respiration, heart rate, okay, same as an animal. This part deals with balance, same as an animal. This part deals with vision. As we move forward, now we get more into important stuff. This is where the memories take place. This is the executive function, okay? So depending on where the brain is injured will tell you a lot about the symptom pattern. So when people have lots of those vascular events, remember we talked about that vascular? Well, this person might be a little spacey, their memory might not be good, and because they had a little bit down through here, their balance isn't good either, okay? That's the way that works. So if we're in chronic pain, I think I mentioned this before, then we ultimately will get a decline in our cognition, okay? So chronic, either local or global pain, that's a person who might have a chronic shoulder problem or a person who has fibromyalgia, eventually changes their brain chemistry because now the brain is in a fight or flight situation and it tries to reroute things. It tries to make the pain better by producing more hormones, but that comes at the cost of changing the way we perceive things in the outside world. Now we become hypersensitive, and most folks who have chronic pain syndromes will tell you all it takes is for you to lightly touch them, and it's so painful because their perception has changed. And unfortunately, because it wraps up with your sympathetic nervous system, almost always people who have chronic pain have increased blood pressure, respiration, their immune system stinks. So not only is it a physical manifestation, now it becomes an internal. And ultimately, these pain patterns cause the brain to re-synapse, so that the shrubbery we start to trim the shrubbery and it looks horrible, right? And then the brain, it shrinks. It actually becomes smaller over time, okay? Not good. So, the last one, we're going to talk about chemistry, okay? The biochemistry. Hormones affect our brain more so than most people think. And I put this up here more just to kind of talk about the big four. Your thyroid, hormone, testosterone, estrogen, okay, and progesterone all have an effect on your brain, okay? Some of them make us think faster. Some of them make us heal faster. Some of them are cognitive. So when a person starts to show cognitive changes, you can't forget that their problem might not be this. The classic sign of a person who has a hyperthyroid situation is they become very skitsy because their energy's up. So this is the person who becomes very antsy all the time. And their presentation might not be like, oh, I've got to run. It might just be that their brain is racing all the time. Okay? On the flip side, when we become hypothyroid, this is the person that becomes extremely lethargic. So maybe they just don't remember things really well. Okay? Guys, when their testosterone drops, now our acuity, our mental crispness becomes less. Estrogen and progesterone both protect the brain. So when those go down, maybe the brain doesn't heal as quickly. And guys produce estrogen just as much as they produce progesterone. It's just less in guys than it is women. So they're very important. In matter of fact, there's actually some interesting research that shows that using progesterone after head trauma, concussions, might be a way to buffer the effect of it. So we can manipulate hormones to change our brain function. So the first thing that you want to think about if you wonder how healthy your brain is you should wonder how healthy your hormones are. So when you get your blood test every year, and I'm going to show you what we should test for later, add these guys in. Because if these are out of balance, then your brain's going to take an excessive amount of beating because of it. Okay? But a lot of people don't think about their hormones. Women think about it because they have hot flashes. Guys think about it because they're putting on weight and they're tired or what have you, but it has a lot to do with your brain. Okay? How about water? Do you think water has anything to do with your brain? Okay, it has a lot. Because, probably 65% of all your connective tissue, your brain being one of them, is water. So if you stay hydrated, then your brain stays plump. Now look here, this is a cool MRI. So somebody did an MRI of a person here. And I'm sorry guys in the back, this is a brain, and you see that there's a lot of blue here and just a little bit of black. This is a person who's dehydrated. See all these nooks and crannies that appear? That's what happens when you're dehydrated. When you're dehydrated, your brain physically shrinks and it'll start to pull away from where it's attached. That's why people get headaches, one of the reasons, with dehydration. Because as your brain shrinks, it literally is pulling the connective tissue called the meninges away from your skull. It's highly vested with nerves, and that's one of the reasons that people get headaches with dehydration. And that could be just not drinking water. This is the person a lot of times who wakes up in the morning with the headache because they hardly drink any water all day. They have a couple cups of coffee, and then they wonder why. Well, I must be sleeping wrong because I wake up with the headache. Well, no, it's probably because you just don't drink any water. The only liquids you get are coffee and soda. So think about that. CSF is cerebral spinal fluid. That's that fluid that bathes it. That's a liquid. So you want to be hydrated. It sounds simple, but it's a biggie. Blood sugar. We've heard of type 1 and type 2 diabetes. Well, there's kind of a type 3 diabetes. And that's the way the blood sugar adversely affects our brain if it's too high, or if we have insensitivity to our insulin. Insulin's a chemical messenger that tells our cells to open up, to allow glucose to go into work. And as time goes by, insulin in most folks becomes less responsive. In some folks, it becomes tremendously less responsive, and that's most of the time why we get type 2 diabetes. Our body doesn't know what to do with the glucose because it doesn't understand what insulin is asking them to do. So what does the body do to combat that? It just produces more insulin. The problem is insulin is a protein, and as we produce more of it, it starts to gunk up the works as well, okay? Specifically, here we are, back to that mitochondria. It starts to put sugar literally in the gasoline tank. So now the engines don't run, okay? And as that insulin stays high, we start to lay down these plaques, okay? And we don't pick these plaques up. So it accelerates the Alzheimer's effect, okay? The interesting thing is, not only do we see these plaquing in the brain, but people who have high insulin levels get plaquing of amyloid in their pancreas as well. That's pretty interesting, isn't it? So, blood sugar, super important. So if you don't keep it under control and your insulin's out of whack, then we're going to have problems. So at the end, I'm going to talk about how important it is to control all these comorbidities: hypertension, diabetes, cholesterol. Those, it's just real straightforward. What does your stomach have to do with your brain? Besides your brain telling you you're hungry. Does it have anything to do with it? It actually does. There is direct communication between your gut and your brain that has more to do with telling you that you're hungry. And sometimes this communication pathway will break down, and it happens most of the time because we develop something called leaky gut. Have we heard of this concept? Okay, so what is leaky gut for folks who haven't heard of it? Leaky gut is when we start to absorb things into our bloodstream that shouldn't be there because the gut itself becomes more permeable. So here's our gut, here's the inside of our intestines, here's the gut lining, here's the blood, right? So here, the cells are nice and fat, right? And they're tight. Here, they're not tight, okay? And this often happens because we have imbalances of bad things. We have toxic things in our guts, bad bacteria. Maybe we eat things that we are allergic to, antigens, so gluten, peanuts, okay? What that does is it causes inflammation here, and as it becomes inflamed, then the cells slightly separate. Now, all of a sudden, we start to absorb things. Toxins, microorganisms, all these guys. At that point, our immune system needs to do something with it, and it often will start to attack it. But because the immune system is not necessarily site-specific, not only will it attack it here, it'll start to nibble up in the brain. And it goes back to what I remember, the blood-brain barrier. So your blood-brain barrier is like this barrier. So as we weaken the blood-brain barrier, now things get into the brain that shouldn't be there. So this is the direct connection between the gut and the brain. So I don't know if anybody, who watches NBC in the morning, like at 7 o'clock in the morning? Anybody watch NBC News? So 2 days ago I was having breakfast. There was actually, I didn't get to see it, they actually had a piece on it, was about kids that had ADD. I've known about this and the other docs have, but it was about how the connection between gut function and ADD, and I'm sure they were going to go into this. So I'm going to see if I can go onto their website to see what they had to say. So gut function is so important when it comes to brain function. So everything you put in your body obviously gets turned into fuel, but sometimes it doesn't, and it gets turned into all these types of bad guys, and it causes all of these issues. This is a big one with this, systemic inflammation, okay? Everything's about inflammation, guys, okay? So here's the axis between the gut and the brain, okay? So there's direct correlation between weakened gut health and the likelihood of getting dementia, ADHD, depression, anxiety, okay? Again, it comes back to systemic inflammation or an imbalance of bad bacteria or maybe even a fungus or a parasite, okay? And then we trigger that inflammation and we damage the blood-brain barrier, okay? So, how do we test all this, okay? Let's talk about basic stuff. So when you go to your doctor's office, if you want to get a basic understanding of the way your body is working, that has a lot to do with the way your brain is working, these are tests that I think are extremely important, okay? Remember, inflammation does not discriminate. It's going to attack anything and everything. So when we can reduce inflammation, it becomes a good thing, okay? So these are markers that I will routinely run that help identify unchecked inflammation in the body. Inflammation has a lot to do with proteins. I'm saying that again. So these, ESR, CRP, homocysteine, these are markers of protein. These are inflammatory markers. So when they are elevated, they're going to damage things. They're going to damage connective tissue. They're going to damage blood vessels. They're going to damage nerves. Iron, we store it as something called ferritin, okay? How many people take iron supplements in here? Does anybody take iron? Do you know if you need iron?
The reports.
Okay, so that's a good answer. So iron is appropriate when it's needed. If it's not needed, do not take it. Iron will attach to things and not release itself. What happens when iron is exposed to oxygen and to a liquid? What does it do? It rusts. It will rust in your body. That's what happens. So high ferritin, bad news, very inflammatory, especially with guys. Don't be taking iron because you think you need it. Only take it if you do need it, okay? Blood sugar markers. Everybody should check these. Glucose, something called A1C. That's a 3-month representation of your blood sugar. And fasting insulin. Check that. If your insulin is just high when you're fasting, boy, your body's not doing a good job, okay? That means your body, the insulin is just waiting for something to do, and it's not going to find anything to do. So very bad thing to have. How viscous is our blood? So cholesterol's fine, right? What's the ratio, good to bad? And do we have these kind of sticky guys called fibrinogen? Does our blood want to clot too soon, okay? Hormones, we can check cortisol, estrogen. These guys, these are good to check. Remember, hormones are above and beyond hot flashes, and because somebody is tired. I mean, this has to do with brain health. Food allergies, that's a great thing to test for. Okay, if you have food allergies that you're not aware of because you don't have an immediate reaction, there's two types of reactions. There's immediate, I eat a shrimp and I'm gonna die, right? I gotta go to the ER. And then there's these delayed ones. These don't show up for 2 or 3 days. So this is the person who's always got brain fog. This is the person who's always achy. And because they have wheat every other day or every day, they'll never make the correlation. So food is a big no-no for some people. They eat the wrong things. You can study the health of the gut, and you can look for infections that might be lying quiet, okay? Lyme disease is probably the most famous one, okay? So Lyme disease, different forms of the herpesvirus, and these guys are the ones that would cause mono. These can cause issues down the road. Okay? Viruses are tricky. They fly under the radar. Your immune system doesn't usually pick them up. So what they'll do is they'll turn things on, turn them off, turn them on, turn them off. But if it does that in your brain, it can cause significant issues. And for some people, there's been heavy metal exposure. Mercury, cadmium, lead, those types of things. That's a real thing. I see that more so than I would like. Okay? So let's get to what we really want to talk about tonight, and it's that little handout you guys have, okay? You all have that? Where's that little flyer? This. So this is probably the new generation way to check on brain function, okay? The testing I showed you before has been around forever. This is new generation stuff. This test was developed by a doctor in the Army, specifically to help with guys that were taking head trauma. Okay, he found that this testing is interesting. Well, maybe it could carry over to people who have dementia. Maybe it can carry over to Alzheimer's. Maybe it can carry over to ADHD. And by collaborating with Harvard and Stanford, they said, you know what? Actually, this is a great model for it. So this test, brain span, is broken up into 2 sections. One is a metabolic test. It's a blood test that looks at markers specific to inflammation in your brain, and it looks at your ratio of omega-3s. Remember that? Omega-3s are the good fats that surround our nerves. So if we have low omega-3 content and we have too much omega-6, then the ratio is not good. So our brain doesn't function. So this is a sample of someone who's done the test over time. This line is the first time they did it. Here's the second, the third, onward to the fourth. And as you can see, this person's omega-3s were not good. They had lots of inflammation. They were toxic. And then these are cognitive tests that look at your memory, your attention, you do this test online, okay? Your cognitive flexibility, and how quickly you process things, okay? So this person had deficiencies here. The testing is great because it shows you how to implement things to improve it. So over time, by changing the omega-3s, by doing different battery of tests to increase attention and cognitive flexibility, these are online tests, this person's scores went up. Okay. There's two types of people that I classically see do this. Number one, the person who is convinced that they have dementia or have Alzheimer's. And they typically do a little bit better than they thought because their problem wasn't so much that they had dementia and Alzheimer's, some do, but it's because they really don't pay attention until they want to pay attention, okay? Okay? Now, I'm not saying this is a joke, I'm just showing you the way this works. The second guy that takes this is the jock lab guy. This is the guy who wants to run every test to prove that he is the healthiest guy in the room. This is the guy that typically when I run hormones or run this, he doesn't do as well as he should. So he's just been kind of living on fumes. So the take-home message is with this testing or any testing is you don't know until you know. Meaning, don't make the assumption that because, boy, I've got brain fog that I'm going to have high cortisol and bad omega-3s. You just don't know until you know. So when it comes to physiology and treating things, you always want to play defense. So I know it's tempting when you read an article about the latest and greatest vitamin for whatever. So then you order it. 2 weeks later, there's another article. Wait, I got to get that one. So now, that's the patient I have, and the proverbial little old lady who comes in with a bag of vitamins. Okay? It could be a guy too. The problem isn't that she's going to kill herself for taking these vitamins, but the problem is she might be manipulating her physiology on one end, like I said before, and messing something up on the other end. So this is the test. This is the best way to start if your concern is to see where your brain is. Because not only is it going to quantify if you pass these tests, and these are standardized tests to help quantify dementia and Alzheimer's, and this is what they do if you went to a specialist, but they don't do these. Okay? And typically when you fix these get better. The interesting thing is the lab that provides this will also tell you things that you can do naturally. Let's say you're just low on this category. It'll tell you nutrients that help with memory, tell you foods to avoid. Same with this, this, and this. So it's, I love the test. It's great. And tonight, we're basically giving you guys the test at cost just because we think it's that important. But, thank you. You're perfect. You've been good all night. She goes, how often do you take it? If you do a lab test, we have one data point. If we want to see a trajectory, we need at least 2 points, right? Right? And if we want to see a trend, you have to have more than 2 points. So to answer, that was perfect. You need to do it and then redo it. And if it's you want to see trends that it's improving, and then ultimately you get to a place if you do it every couple of years, you're fine. Again, most people aren't as bad as they think, and most people who think they're great are worse than they think. Okay? I don't know why, but that seems. So what can you do? Let's just go through some quick stuff. And it really depends on what your lab testing comes back as, including the conventional stuff that I listed with the hormones and all those other things, and then the brain span. These are just generalized 6 steps for a better brain. If you have these comorbidities, you better address them or else your brain is not going to be happy. So if you have high blood pressure and it's unchecked, your blood vessels are basically going to get beat up and they're going to plaque over and you're going to have problems. Diabetes, obesity, chronic trauma. If you're the guy who likes to play whatever sport and has had multiple concussions and seems to keep on falling, you probably need to think about that. And if you have chronic pain, for folks who are in chronic pain, their brain is slowly shrinking. Okay, so you have to address this. So if your problem is you've just got chronic back pain, well, yeah, it's your back that's hurting, but it's also your brain. Okay, you need to reduce inflammation, so that's diet a lot of times, hydration. Sometimes you take different supplements. We've heard of curcumin and turmeric, and those help, right? But if the diet's poor, you got to change that. You can only override the physiology so much by taking vitamins. okay? Physical exercise, I'm going to show you this in a second, improves sleep, right? We talked about that. Mental exercises, so this is not a joke, those folks that do Sudoku, crossword puzzles, those people score across the board much better than folks that don't do any of that stuff. And a really underappreciated one is just social interaction. So when people start to think that they're getting a little less sharp, they start to withdraw, they don't communicate. Remember, how do nerves learn? By touching as much as they can, same with the body. So if you withdraw, you're going to accelerate this, okay? Some of the biochemical stuff, watch the potential, see how I said potential, not always, but potential allergens, wheat, soy, corn, dairy, those are the big ones. They cause a lot of problems in people. All processed foods, okay, stay away from that. It's processed to keep it on the shelf. You don't want to, you don't want to pickle yourself. Sulfites, nitrates, MSGs, and preservatives, those are all known neurotoxins. Okay, they make our brain do things that it shouldn't. Who has sensitivities to MSG? Who gets headache? So you're lucky because your brain tells you that. There are other folks that doesn't. You're lucky to get a headache. Same with wine. Who gets headaches from wine? Sulfites, okay? Sugary foods and drinks, be careful with those, okay? And you want to eat a diet that's really based in vegetables, quality meats. Remember, red meat is okay. A lot of it can be very inflammatory. It produces something called arachidonic acid, which is the opposite of omega-3s in the cold water fish. And then you want water from a good source. Tap water that's fluorinated and has chlorine in it, in my opinion, is very questionable. We could have a whole topic on that because fluoride and chloride are what's called a halogen. Halogens, if you remember chemistry, fall in a line in the periodic table of elements. They all mimic each other, okay? They can kind of cross-communicate. Guess what else is in that column? Iodine. So we start messing with iodine and displacing it because we got all this fluoride and chloride, and potentially it could be a problem. Okay, my opinion. Okay? So this is a great slide. This is just exercise. If you guys just do two things when you leave here, eating better and exercise, you're going to help a lot of things. So the pink is a sedentary group. This is an exercise group. I wish I knew what they were, the form of exercise, but I don't, I apologize. So this is a person that has cognitive impairment, but has yet to be diagnosed with dementia. Okay, for people who are sedentary, the general population of whatever they consider elderly, probably over the age of 70, 15% who are sedentary will get this. People who have exercised, only 6%. That's a big difference. We're just talking exercise, walking. Here's Alzheimer's. 7% sedentary, 2% active. It's a big drop, right? Statistically, this is a biggie. If a pharmaceutical company could show this drop, they would be super excited and be telling everyone. Trust me, they would, yes, because they use numbers. So from a percentage, going from here to here, that's a huge percentage drop. So here's the vascular, okay, so it's about 50% less, if you want to look at it that way, and generalized dementia. So just move. If you eat right and you move, you're going to start to go in the right direction. Not to mention all the other collateral benefits of exercise and eating better. Inflammation being one of them. Okay, omega-3 fats, if you're not taking them, you should probably consider taking them. Make sure they're from a verified source that is heavy metal free and free of PCBs and stuff like that. 60% of your brain is made up of fat, so there's a lot of fat in your brain. Of that, 40% is what's called DHA, that's one of the omega-3s, and 20% is EPA, okay? We typically think of that from fish oil, right? That's the triglyceride form. It's not really made in the body, and it's very difficult for you to take, unfortunately, things like flaxseed and convert it. You're asking the body to take sand and make glass. It takes, you gotta be, it's tricky, and it can be shunted off in the other direction. That's why this is the granddaddy. Krill oil, people ask about this, in some studies, because it's a phospholipid, which is a little bit different than triglyceride. it's more easily absorbed and utilized. So I'm good with either. I take a fish oil, but krill oil is great too.
Quick question.
Yep.
I find when I take the Nordic Naturals, the mercury-free
Uh-huh.
fish oil, the omega-3,
Right.
the expensive one, I get these micro capillaries in my face. I tend to bleed more.
Well, this is perfect. So she said she gets these microcapillaries that are becoming fragile.
Right, I mean.
So because it's a blood thinner.
Right, so should I?
Yes, so people who are on blood thinners need to be careful taking omega-3s. But that's one of the benefits. It makes your blood less sticky. But if that's doing it to,
I'll bruise more, I mean.
so then I would back off of that.
I don't take that many, I mean, just one a day instead of two, but
You might want to have your clotting factors. Any family history of that?
no.
Okay.
Well, actually, they say people who are fair, blonde hair, blue eyes, that's classic. I've had nurses tell me that. I always bleed out if I have surgery.
Oh, really?
That's really 30 to 40%, she said.
Okay.
So, but I like it because my brain works so well.
Well, then try krill. Maybe it won't do it as much. I don't know. It'd be worth trying. Okay, but if you're bruising, then you probably want to back off of it a little bit. I mean, you don't want the K2 helps with traditionally we talk about it with clotting. Okay, there's K1 and there's K2, and it has a lot to do with helping cells understand. A good example is calcium. What it directs calcium. So I mean, it does a lot of different things.
Does it take away from the fish
No,
oil or the krill?
No, it can help it as well. Yes, sir.
Relative to her, didn't you say early on that after you build up to a certain level, it stores it? Maybe she's got so much.
Exactly.
It's overflowing.
So that's a great point. So the test, okay, that test that I showed you, it basically will tell you how much to take. And then when you hit that number, it's going to tell you what to take to maintain.
Gotcha. I already paid for it, so I'm gonna take it.
So it's been, every time I run it with a person, I gotta say to myself, these guys are pretty spot on. I don't know how they come up with their algorithm, but it's kind of impressive. So you end up taking less, which is good because nobody wants to take a handful a day, because who has problems when they take it, they repeat, they belch it. Yeah, so you can freeze it and swallow it frozen, and it'll pass through your stomach before it thaws out. Most of the time. That's just a little secret. So these are some supplements that I think have some validity. There's tons more. I could have made 60 pages. Again, you don't know until you know, so it makes more sense to test to see where your deficiency is. There's a B vitamin called niacinamide. It has a lot to do with the mitochondria. It helps this protein that actually heals things in the brain. Phosphatidylserine and choline, they work like a firewall, so they protect the brain from getting damaged from inflammation. This is a great one to take if you're under a lot of stress. Vitamin D, oh God, you can find a zillion peer-reviewed articles that show the connection between vitamin D and Alzheimer's, dementia, anything you want to find a connection on. Chronic pain, everything. And then some things just to reduce the stress response. Valerian, magnesium, theanine. These reduce the stress response. They buffer things.
What is theanine?
Theanine, it's an amino acid, L-theanine. Yeah. This works. L-theanine works good with people that have anxiety.
How about kava root?
Kava, yeah, there was some controversy at one time with kava. I don't,
Kids have used it, but.
Yeah, it's. I don't necessarily see a problem with it. I mean, again, when it comes to the botanicals, you want a good source. I wouldn't be buying botanicals from unverified source in China because you don't know what's in it. I mean, you don't. These are just general things that just slow the mind down. If we want to increase GABA, there's something called taurine. Magnesium, that's an all-star. Everyone should probably be taking magnesium. It's a natural muscle relaxer, supports GABA. It's involved in over 400 chemical reactions. It's super important, hard to get in our diet. The adaptogens, rhodiola, ashwagandha, ginseng, we've heard of ginseng, right? That helps our body handle stress, okay? And then foods that are good, okay? And then obviously different things depending on your need. Not everybody is the same. So one person might be high on one test and low on the other, and then vice versa, so you're going to do things to handle them. So I'm going to stay after this to answer any questions, and I'll open the floor up now for folks who want to do, we'll throw some questions out. I think this testing is extremely important for a couple reasons. Number one, it gives you a baseline of brain function. It doesn't give you all of it, but it gives you a good understanding of, okay, how good is my working memory? How good is my spatial orientation? All of these things. And it gives you all these markers of inflammation. Remember, inflammation does not discriminate. If you have inflammation in your brain, you have it in your spine and your shoulder and all those things. So it gives you a great insight into that. What you do with it is up to you, and the reason I say that is a lot of the things that we talk about in this office have to do with lifestyle modification. If you came here to get a prescription for the latest and greatest drug, you came to the wrong place. If you came here to get insight on ways to prevent taking the latest and greatest drug, we have that. So it takes a little elbow grease to fix some things, not horrible. So, when you leave tonight, think about, okay, where am I and what am I willing to do to get there? All right, I'll exercise 20 minutes a day. All right, I'll do that. All right, I'll cut back on the sugar, or I'll do this. I'll try to sleep better. If you're willing to do that stuff, then I know you can get better. If you're not willing to do it, then you're looking for the magic vitamin or the magic pill. It may help temporarily, but it's probably not going to address the major issues.